Well, welcome to this video, and what I want to do today is introduce my new Pathophysiology book. Now, quite a few of you have already bought the Physiology Notes. The Physiology Notes is the book that's in white, and already quite a few of you have bought this. But just before I introduce the Pathophysiology Notes book, I'd like to tell you that the money that you have paid for these books in the past 12 months has supplied 600 free books to students in Cambodia and 700 free books to students in Malawi. So already the project is starting to expand. This of course is still available, but there's another video on that, so you can watch that at your leisure. But today I want to tell you about the new book. This is Campbell's Pathophysiology Notes. So the white book is all on normal function, it's on physiology. This is all on abnormal function, it's pathophysiology. And what we try and do is we try and relate etiology to pathophysiology. So what is there that goes wrong, that causes some disease process, that causes some altered physiology in the body? So how is disease caused? And of course that's very important, because if we know how disease is caused, we can advise our people on how to prevent illness and to stop getting sick in the first place. But given that unfortunately there has been an etiological factor or a group of etiological causative factors that have caused some altered physiology, they've caused some pathophysiology, then it becomes necessary for us to understand that pathophysiology. Just what is it that's gone wrong in the body? Now, why is it so important that we understand pathophysiology? It sounds rather academic. Well, of course, it's the pathophysiology, it's the abnormal function that gives rise to the clinical features. And this is how we're going to recognise disease, by the clinical features, by the signs that we see and by the symptoms that the patients report to us. So we understand the clinical features in the context of the pathophysiology, in the context of the etiology. The three are kind of going together. And if you understand the pathophysiology and you understand the clinical features in a disease, then very often what you need to do to correct that abnormal function becomes fairly obvious. In other words, the whole point of this exercise is that we come to understand what we're doing in clinical practice and we're able to help our patients. So firstly, we want to learn to keep well people well, to stop them getting sick. Then if people are sick or traumatised, we want to be in a position to help them with understanding, by understanding the processes that are going on. That's the aim of this book. Now, it is not a detailed textbook. Now, there are a lot of details in it, of course, but the purpose of the book is to teach. It's a teaching book as opposed to a reference book. So we start off with fairly simple ideas, we relate those to the physiology, and then we develop them. We try and explain them. Now, I've been teaching for about 20 years now, and because I've been teaching for such a long time, I've kind of worked out ways of developing a subject, almost as if to try and teach it on the page. So what I'm trying to do is put together my teaching experience to bring people up from a fairly basic level to a more advanced level, but progressively. And the focus is on teaching and understanding the principles rather than just giving whole amounts of screeds of information which you can get from the internet readily anyway these days. So the idea is to teach. And if you've seen my videos on YouTube and if you've seen the physiology book, you know that a big part of the way I do this is by using diagrams. So let's just have a look at a few of the diagrams in this new black book. I've just flagged up a few that might be interesting. Now here, for example, we see this diagram explains the difference between stable angina and unstable angina. So as you probably know, angina is the pain caused by myocardial ischemia. And here, because there's atheromatous plaques occluding or partially occluding the lumen of the coronary arterial vessel, there's going to be reduced amounts of blood can get past here. That means whenever the metabolic demands of the myocardium exceed the ability of the circulatory system to deliver oxygen to those tissues, then there's going to be the clinical features of myocardial ischemia. And this is the pain that patients get of angina of effort. But angina can also be unstable where there's thrombus formation, probably going to be white thrombus, platelet aggregation thrombus, because of a rupture of an atheromatous plaque. And this means that there's the risk of thromboembolic occlusion, partly of this vessel itself and of distal vessels as this washes off downstream. And if this unstable angina becomes bad enough, it becomes a non-ST elevation myocardial infarction. And if red thrombus complicates this, it's going to become an ST elevation myocardial infarction. So that's an attempt to explain that in diagrammatic form. Here we see an example from the respiratory system. Here we see an alveoli, and in the alveoli there are some white blood cells, but there's also some nasty smoke particles here as well. And the white blood cells are trying to ingest and phagocytose the smoke particles, but that makes the white cells release proteolytic enzymes which can break down and digest the wall of the alveoli. That means instead of having lots of alveoli, we have bigger spaces, and this is the basis of emphysema. And this diagram shows why emphysematous patients sometimes find it difficult to breathe out. Here's an example from the nervous system. This looks at the potential areas where thromboembolic complications can arise, giving rise to a cerebrovascular accident. So thrombus can develop here or here or here in various parts of the circulatory system, and there can be embolization into the cerebral arteries, and this can give rise to an area of cerebral infarction, giving rise to the clinical features of a cerebrovascular accident. Here's an example from trauma. Here we see the different places that blood can accumulate within the cranial cavity. So here we have the skull round here, and here we see there's an extra or an epidural hematoma, and we see that that has occurred between the bone of the skull and the dura mater. Here we see there's a subdural hematoma. This has occurred underneath the dura mater but above the arachnoid and pia mater. Here we see there's an intracerebral hemorrhage within the cerebral cortex itself. And on this page we see a normal brain here with a normal midline going up the middle with a nice symmetry of the brain. And here we see the effect of an area of hematoma pushing across the way, causing midline shift and distorting the position of the ventricles. Now, what I've tried to do with these diagrams is simplify them as much as possible, because the idea is that you can learn the diagrams yourself. But I've also tried to keep them as anatomically accurate as possible, but while still simplifying them. So hopefully you are going to learn some proper anatomy as you go through, but also you're going to learn simplified ways, yet hopefully still accurate ways of coming to understand these situations and hopefully learning the diagrams yourself. What's this one? Oh yeah, this is a recess factor incompatibility. So when a recess positive father marries a recess negative mother, there's the possibility of a recess positive fetus developing inside a recess negative mother. During the process of birth, some of the fetal red cells can get into the maternal circulation, and that means the mother will make antibodies to the recess factor. That doesn't cause problems in the first pregnancy, but in subsequent pregnancies it can, because the antibodies can get in and attack the baby's recess positive cells, causing recess factor incompatibility. It's all explained in much more detail in the text. I'm just giving you a quick rundown now. What's this? Oh yeah, this is the adenoma-carcinoma sequence. So as you probably know, bowel cancer is very common. It can start as an adenoma here, which is non-malignant but potentially pre-malignant within the lumen of the bowel. And then that can turn into an adenocarcinoma, which can invade through the wall of the bowel, giving rise to peritoneal spread, lymphatic spread, and distant spread via the blood. In other words, it becomes a malignant condition. And of course the aim is for us to catch it at this stage, at the adenoma stage, before it becomes the adenocarcinoma stage. But again, understanding the pathological processes can only help. Maybe just one more example. This is an example of acute tubular necrosis complicating, causing renal failure. So here we see that there's been some insult to the nephron. This is the lumen of the nephron. That there's been necrosed cells that line the nephron, and these have occluded the nephron here. This means that the glomerular filtrate cannot get through the nephron, and because the glomerular filtrate cannot get through the nephron, urine is not going to be formed, resulting in an acute renal failure, presenting possibly as an oliguria with a reduced amount of urine, or an anuria where no urine is produced at all. So that's just a few of the ideas that we teach with diagrams. Now I'm just going to run through the chapters now. Now some chapters deal with principles, general principles. For example, we've got nature and etiology of disease, the principle of neoplasia, the principles of infectious disease, disordered immunity, disorder of arteries, disorder of veins, shock, and hemorrhage. All related to general principles, as are the chapters on hypoxia, wounds and healing, alterations in body temperature, fractures, burns, and pain. These are all separate chapters dealing with general principles of disordered function. But then of course we do the specific systems as well. So we have a chapter on cardiac disorders, hypertension, respiratory disorders, nervous system, head injuries, endocrine disorders, diabetes mellitus, disorders of the blood, gastrointestinal disorders, disorders of the liver, the gallbladder and bile ducts, the pancreas, genitourinary, male and female of course, and renal disorders, dealing with much more specific things. So hopefully by the time you've worked your way through this, which hopefully you can, you're going to have a bit of a feel for pretty well the whole field really. And hopefully that's going to inform all your future more detailed study. So just for example, let's look at some basic terms we cover in the first chapter on the nature and etiology of disease. Well, I start off here with some basic terms. So just what does physiology mean? What is pathophysiology? What do we mean by cytology? What is histopathology? These basic terms we need to understand. And then we go on to talk about the causes of disease. And I first of all start off by talking about endogenous etiology. Causes from within the individual. So we've got genetic disorders, and then we can break those down into autosomal disorders or sex-linked disorders and genetic predispositions to various diseases, disorders of chromosomes. And then we talk about the implications of genetic knowledge. What implications does this have for the human race? What does it have for us as individual nurses, doctors, clinicians, teachers, whatever we happen to be? Lots of interesting implications there. Then we go on and talk about exogenous etiology. Now, exogenous etiology describes the causes of conditions which arise from outside the individual. So it's not coming from inside the individual, but it's the way environments are affecting the physiological processes inside an individual. And we start off with really obvious examples like infections, microorganisms. Then chemical toxins, the way that these can abnormally affect us. Physical agents here, such as heat, cold, trauma. What happens when a tissue is traumatised? Radiation's mentioned there. Then we talk about nutritional factors. Remember, malnutrition can mean not enough of a nutrient, but it can also mean too much of a nutrient. So we talk about malnutrition and disease. Then we go on to degenerative disorders, the sort of disorders we're more likely to see in elderly patients, such as osteoarthritis or dementia. Then we talk about abnormal immunity. there's been a great increase in the world, really, in autoimmune diseases, for example. So just what is an autoimmune disease? What does it mean? Well, we look at the fact that auto means self, and immune relates to the ability of the body to resist infection. But sometimes the immune system targets the body's own tissues, giving rise to autoimmune disease. Diabetes mellitus type 1, for example, it is virtually a global pandemic, but it's an autoimmune disease. So if we can understand what's going on here, hopefully we can prevent and better treat this condition. Then we talk about neoplasms, new tissues, new growth. And these can be benign, meaning they don't spread around the body, or they can be malignant, meaning that they do spread around the body and metastasize to secondary sites, giving rise to secondary tumour formation in different parts of the body. Then we talk about psychosomatic influences on disease. Now, psycho means mind and somatic means body. And the mind and the body really can't be separated. So very often the mind can affect the body, giving rise to psychosomatic conditions. Then we talk about psychiatric disorders, psychotic disorders, neurotic disorders, organic disorders, functional disorders. What do these terms mean? Why is it important for us to know the difference between an organic and a functional psychiatric disorder? Because it is. It's very important to know. What's after that? We mentioned iatrogenic diseases. Well, iatros is a Greek word meaning doctor, and very often, unfortunately, because of our treatments, we can cause disease processes. We can actually cause diseases in our patients, iatrogenic disorders. And it's very important we know about these because we want to prevent them. We should do no harm. And unfortunately, in medical and nursing care, very often we do harm, and it's a bad thing. So we need to understand iatrogenic disorders so we don't do harm. Then we talk about idiopathic diseases that we don't really know the cause of. And we talk about multifactorial etiology. So in any particular disease, really, the cause is usually going to be a combination of genetic and environmental factors. So if you don't know what's causing a disease, you can put on a serious face and say, well, the etiology of this disease is probably a combination of genetic and environmental factors. And you're always going to be right pretty well because usually there's a combination of factors. If we take heart disease, for example, there's genetic factors which can give rise to high cholesterol, can give rise to high blood pressure. And of course these can affect the coronary arteries, giving rise to ischemic heart disease. There are genetic factors there. But lifestyle factors are also massively important. Whether someone smokes or not, their diet, their exercise can all influence the disease process. So very often the etiology of disease is complicated because it's multifactorial. Then we talk about congenital disorders. Now, a congenital disorder just simply means one that's present at birth. And we talk about teratogenesis, which is abnormal fetal development. You might remember the appalling thalidomide tragedy quite a few years ago now, but commonly we still see fetal alcohol syndrome caused by mothers drinking too much. And we also mention the fact that if the father smokes when he's making the sperm, that can cause mutations of the sperm and make cancer in the children more likely. So it's not just the mother, it's the father or the potential father that needs our health information and education as well. We talk about drugs, intrauterine infections, radiation, massively important. Anytime we are x-raying a woman, we must always ask if there's any possibility they are pregnant, because the radiation can have extreme adverse effects on fetal development. And we talk about the effects of nutrition on fetal development as well. But then we go and talk about healthcare and disease etiology. Why do we need to know this? Well, we talk about the principle of prophylaxis. How do we prevent disease? So immunisation, for example, is a form of prophylaxis. We're giving a treatment so we can prevent a disease process from developing. And then we go and talk about identifying diseases. How are we going to identify diseases? So we talk about the clinical features, the signs and the symptoms, and we talk about syndromes. What do we mean by a syndrome? And we talk about the importance of taking history and assessing the patient by talking to the patient, by talking to the patient's relatives. Then we talk about pathological investigations, blood tests, sputum tests, whatever investigations we'd like to carry out. Then we talk about other investigations such as x-rays, scans, other things we can do. Then we look at the principle of differential diagnosis. Then we talk about the difference between acute and chronic disease. What do we mean by an acute disease? What do we mean by a chronic disease? What are the implications for care in this? Then we talk about fulminating disease. What does that mean? And we talk about complications and sequelae of a disease. Then we differentiate between localised disease and generalised systemic disease. So just what is the difference between a localised infection and a systemic infection? What clinical observations will inform us that there is a local infection, and what clinical features will inform us that there is a systemic infection? And what implications will that have for the way that this patient is going to be managed? Then we work out what a lesion is. Just what do we mean by that term, lesion? What is it? And then we talk about the natural evolution of a disease, how a disease progresses through various natural stages. Relapses, remissions and exacerbations. What do these terms mean? Just what is convalescence? And then we talk about terminal disease and the importance of palliative care and the principle of prognosis. Then we mention epidemiology, incidence and prevalence. What is incidence? What is prevalence? Well, incidence is the number of new cases of a disease in a particular period of time. Prevalence is the number of cases of a disease that exist today in any one particular area. So why is it important to know about the difference between incidence and prevalence? What are the implications of this knowledge? Then we talk about correlation studies and screening for disease. What are the advantages, disadvantages of screening, and what are some examples of screening? Well done if you're still listening to this video. That was the first chapter, and the aim of that chapter was to introduce us to the basic principles behind the study of disease. Then the next chapter's on neoplasia. But I'm not going to go through that because I think you can buy the book. It's £14 in the UK. It's $30 if you're in the US or outside of the UK. So go to Campbell Teaching. That's CAMPBELL Teaching, one word. campbellteaching.co.uk. campbellteaching.co.uk, and there, using PayPal, you can order the book. Or if you want to email me if you live in the UK, and then I can post you copies directly. We can normally get copies out to the UK within 2 or 3 days. Delivery to the US is quite variable actually. Normally it takes about 10 days. So if you live in the US and you ordered the book, I would hope you would have it within about 10 days of your order. Okay, thank you for listening.